As we are coming in, I want to mention that we are building a Camino of compassion and peace from Monterey to San Antonio. And this evening, Carlos Odinez from Monterey, who's working on the Camino on that end, he and his family will arrive in San Antonio. And I am having an informal conversation supper at 5 tomorrow about building this Camino of compassion and peace. And so far, I've been inviting people who are, you know, kind of in peace on earth class or compassion class, but I want to open it because I feel like we're all good people doing this together. So I'm going to put my email address in the chat box. And I'm hoping that Mark is coming because Mark has been in Peace on Earth class with Carlos from Monterey. And now we could be together face to face.
Thank you. That puts us right into some really good stuff happening. Puts us right into some announcements. Anybody out there have announcements they'd like to share? I see Kathy is with us, so we'll be ready to go into that briefing shortly, but interested in any announcements at this point.
And is Peter. I've got one for this weekend.
Go.
So in the Quintana corridor, we have a nonprofit building a purpose, and it supports the students of the South San Independent School District in a mentorship program. And they have coordinated a old South San Antonio parade down the Quintana corridor, and it's going to take place on Saturday at 3 o'clock, and it's going to start at St. Joseph's Church. It's partnership with St. Joseph's, as well as with a nonprofit and other businesses from the corridor. And there's going to be a block party right in the center at the Building a Purpose site, right in the middle of the corridor at 4 o'clock after the parade ends. So it's a great opportunity to just convene community and connecting and benefiting. We have two grand marshals. One is just a graduate student, and the other is a teacher that graduated from South San and is just retired from teaching there. So just a wonderful event. So just invite everyone out to come out. If you want to participate, still an opportunity. I'll put the information on the link if anyone wants to register to be a part.
Fun. Those are types of things too that any of us could replicate. It wouldn't have to look exactly like, but it's a great idea, right? Block parties are always a great idea too. You can come together in so many different ways, and we know that humans coming together, that's partially how we heal as a people, is coming together.
And I'd like to promote book review next Wednesday. It's Seeing Around the Corner by Rita McGrath. Is how to spot inflection points. And if anybody's interested, go to executivebookreview.com.
Can you go ahead though and give us the details? It's Wednesday at what time?
At 5:30.
And I assume it's at your place at Whittig's.
Would that be a fair assumption? But it won't get you any points. On IH10, right past the Sea Island, there's a 3-story building, and it's right there. And I'll put it in the chat.
That would be great, Mark. Thank you. Think we have time for another announcement? All right. Well, then I'm going to use this minute in a different way. So what I want to invite everyone, first of all, to do today, we're going to be hearing the briefing today, an update on where things are with those who are unhoused without shelter in their lives in our city. The same briefing, of course, it'll be different words, but the same PowerPoint and same information that the council received just a couple weeks ago. But it also made me think how much we have that's happening within the screen itself. And a lot of our briefings do come out of the people who are here. but I'd like to lean into that a little bit more into the spring. So the first request I have is that in chat, so if everybody goes to chat, I'll invite you to do it right now and open it up.
It's okay. Don't worry about it. Beautiful. I'm good with our.
There goes Mark, right? And I mean, not Mark, but Peter. Anyway, I want to invite you to put into chat who you bring with you to the intersection. What I mean by that is that we all know that compassion and civic engagement are not solo acts. So when I come here to the intersection, I bring with me, in a sense, the city staff, some national folks, but Compassionate San Antonio. I mean, when I talk and have these things happening and I go in other directions, I'm talking about what's happening at the intersection, what we've learned about. Those are people that I bring with me. So I invite each of us to put into chat. Another way that we usually ask that is, who do you represent? What congregation are you with? What organization? And that we're counting on each of us to be carrying all this information to those folks, those people we bring with us and walk with every day in our mutual work. So I want to invite each and all of us in chat to write that down and share that with everybody. Who are you with? Who do you bring with you? I think a good example that we just heard with Mark Whittick is the executive book review. And if you don't know about that, you should find out, right? But that leads me to step 2. So inviting Billy Cox is going to put in there sacred.org. Maybe he already has. It's like that. So what I want to do is then next, in our make us can I can talk this morning. It's a little early yet, but a whole series on collaborative efforts that each of us are involved in, and we make those the briefings. So we've already had, I think, a really great example. Peter, you just talked about this gathering event that's coming up, but I want to hear more about the collaboration of the people who made that happen. So in other words, we want to hear about how the work happens in the work that you are doing, not as much about the what that's produced, but the how. How are we co-laboring in the executive book review? How does co-laboring happen within sacred.org? I hope that's sort of clear. And then see, I've got 10 new messages I haven't looked at, so people are responding. So if you are interested in giving a briefing on your how and your collaborative, so it can't be just you, it's about how a group of people work together. That's what we need to be hearing about. Working towards meeting the most vulnerable of needs in our city. The most vulnerable of needs in our city. How are we doing that? So I want to make that, maybe, see how it goes, our next series. Let's hear what we're doing and how we're doing it. I think it'll help us knit us together more, and we'll make some connections as well. So email me if you're interested in doing that kind of briefing, and we'll just see where it leads us. So I know that Kathy is with us. So Kathy, here she is. I've got the share screen open. Kathy works in the same department that I do in Human Services, whose mission is to meet the most vulnerable of needs in our city. And she's an administrator with the department, and she works with homeless outreach. And she's going to be sharing with us today the PowerPoint, I think, maybe she doesn't have to. You don't have to, Kathy, if you hadn't planned that. But she's going to bring us an update on how the outreach kind of continuum, the full picture is working these days. Again, last week, we had an update or actually a tool come to us from Neighborhood Housing Services Department as well as Human Services, a series of 4 videos that we can use. And so this is a part of that same presentation. So we've got a tool, but now Kathy's going to give us an update on the collaborative work that's been happening in our city. Kathy?
Good morning, everybody. So, Miss Ann, I don't know if you want to see the homeless presentation or the presentation that was presented in council, which is really just numbers, right? Our homeless presentation is more of what we do in helping to solve the issues of homelessness and the different housing types, like permanent supportive housing, and giving an explanation of those. I don't know which you want me to present to your team, but I'm ready either way. I'm
Well,
ready.
folks wanted an update. So you could go ahead and what I mean, we've done before too. What you do, it wasn't that long ago when you came and did that, but they want to also know how it's going. And I think one of the big questions is how is that going considering our current context and nonprofits that have lost funding, and they kind of want to know how is it going? I'm not sure exactly how to answer that. That's why I invited you. How is it
Well,
going?
the road is always rocky, right? Especially in this administration. I don't want to get too much deep into that. We so far have not had any agencies that we know of, right, here at our local level that have lost funding. There has been some funding that has ended, right? The COVID funding, the ARPA funding, all those fundings have ended, and we have had to make adjustments to be able to still carry on those services to the community. But if you want to share your screen, I have the share up there. Let me see if I can find I got so much stuff. So this is the briefing that, can everybody see the screen?
Yes,
Yeah.
we can. It's
Okay,
perfect.
so this is the briefing that Mel presented to the student council, to city council. To
And
city, yeah, I do a whole lot, right? So in this
yeah.
briefing, did it go away? Can you
No,
guys
it's
still see?
here. We can
Okay.
see it. Yep,
So
yep.
in the briefing, Mel wanted to reiterate the same thing, right? I guess to ease a little bit of the feeling that people would not. Now I can't see it on my screen. What did I do? Oh, it is. Sorry, everybody. This is giving me a hard time. But you have it, right, Ann?
Yeah, I can see it, Kathy.
And I can't.
Kathy,
Well,
Kathy,
yeah.
sometimes you have tabs across the top in Zoom that are just in black. If you clicked on one to the left or one to the right half of the screen, it might show the speaker instead of your screen real big.
But if y'all can see it, I can see it on my end now too. We'll just keep on clicking. So what Mel presented to the city council was just an update briefing on the annual report. And she wanted to provide the overview of what was happening in the city of San Antonio. So she went over the homeless response system structure, the homeless counts and trends, right? Which we are doing very, very well with that. Budget and spending and the 2024 accomplishments and the 2025 key priorities going forward into the future based on the the homeless strategic plan. So our homeless response system is us, of course, the city of San Antonio. And in that collaboration or continuum, we have the planning and policy, public safety, coordination and facilitation, financial investment, and direct services. Also, close to home, who was our HUD lead continuum of care agency, And they do much more than that, right? They provide a lot of assistance and guidance, not just to the funding, but the systems and processes that lead us to be able to be successful in our housing placement of clients and agencies, and where the money is going, that can do the best good. And then, of course, the funders. Our role, my role, I am the administrator of human services. Well, they say homeless services, right? But I'm the human services administrator. And we provide the planning, coordination, and oversight for the city's investments. We contract with external partners for outreach and shelter and housing services like SAM and Corazon, Haven for Hope. There are a lot of agencies that work with us, but in my direct service, in my direct oversight, right? I have the Community Connections Hotline, the Street Homeless Team, Encampment Response, Homeless Veteran Coordination, the Youth Assistance. We do a lot of data reporting and stuff for dashboards and policy research. And we also work really well with the communications team to make sure that we are getting our message out clearly and succinctly to the community. So the shelter and housing inventory, this is what our shelter and housing inventory looks like. The low barrier shelter, that is mainly from SAM Ministries, and those are the services that we provided. Through our hit count is where we count it says housing inventory count. For us, it's known as the hit count. And the hit count is where we provide the shelter count for people who are in shelters, right? When we do the point in time count, every shelter that houses clients is those numbers are recorded as well, so we can get an accurate count of how many people are in shelter. And we'll see that as we go along through the slide. There's the total number of emergency shelter beds for 2024 and transitional housing, permanent supportive housing. We did just complete 124 new units in FY24 with our ship partners, but permanent supportive housing that was site-based, and that's going to be through SAM Ministries and Essequia Trails. I think I'm saying it right. Opportunity Homes has 6,070 units of total home inventory and deeply affordable housing, right, which is low income housing. We have 1,598 units. So this is a slide that's near and dear to my heart, right? We always monitor how well we're doing, but how many people we're getting off the streets. So since 2015, we have increased our number substantially to getting homeless or unhoused clients off the street. So the number in the blue is the number of clients that have been sheltered, put into a shelter, right? To move on to next steps, be it rapid rehousing, transitional housing, even emergency shelter is a win if you have somebody who has never thought of that as an option to getting stable before. So this shows that even though the unsheltered number has went up a little bit, we've made such strides in getting people off the street and into shelter. And this number is just based on the point in time, right? But I want to say the point in time just gives a snapshot of just one day, where the efforts continue continuously throughout the entire year. So here is our change in homelessness per 10,000 population since 2015. As you can see, Bexar County, we're down to 0.4. It's going across all of the metropolitan areas, equal to San Antonio and Bexar County across Texas. And you see where it says Harris County and Fort Bend County, they were under like to the good, I should say, 35.1%. But those clients were all housed with ARPA funds. The city of Houston took all of their ARPA money and put all of them ARPA money into housing. That's kind of unstable right now since those housing funds have ended. So still overall, we're doing really, really well here in Bexar County. So the effectiveness.
That's an impressive slide. I hope
It is.
everybody saw that.
It tells a lot, right? I think when we first started, when I first started, Bexar County housing would have been I'm sorry, Harris County would have been Bexar County, right? So we're making major strides and accomplishments in getting finding out what the true need of homelessness and what that looks like, right? It's not just homeless, but what's coming behind that. So as we go on in the presentation, we'll be able to talk a little bit more about that. So the effectiveness of our homeless system, the national increase in homelessness since 2014 has been 33.8%. In San Antonio, though, we have an increase of just 16.6, so still under the national level of what homelessness looks like throughout the United States, right? We have unsheltered count decreased by 25% over the past 5 years, while in the United States, there has been an increase of 29.7%. Our chronically homeless population represents 20% of the nation's homeless compared to 14% at San Antonio. And for those of you who don't know what chronic homelessness is, by definition, it is people who have been unhoused for 1 year or more continuously, or 4 separate counts of homelessness within a 1 year period. So someone who gets housed and then comes back to being unhoused, the recidivism, and that's what that looks like. Family homelessness in San Antonio increased by 11.7% between 23 and 24, and we do believe that is because of COVID and the housing moratorium and the increase in unaffordable housing, while nationally it increased by 39.4%. So we're doing really, really well in keeping our families and their babies off the street. Our unsheltered as a percent of total homelessness and population in San Antonio, as you can see, we are on the downswing. I am so happy that we are combining all of our efforts and utilizing all of our resources here in San Antonio. My goal, before I relinquish this seat to somebody else, is to see this at least in the single digits. I'm reaching high for those of you who know the task ahead of us, but if we don't reach high, we don't have anything to reach to. So that's my personal goal. This is the homeless response dashboard that's within the city of San Antonio, and the link is there on the bottom. Ms. Ann, I think you have these slides, and we can share the link if we want for people to see it.
I can do that.
And continue to look at it, right? So this slide just shows the number of unsheltered or individuals that we housed, and it shows the numbers of that have been housed year to date, right? So when you look at the bottom, though, the thing that I want people to focus on, well, maybe not to the bottom, but look over to the right where it says return to homelessness. Of all of those that we've housed, we've had 650 return to homelessness. And in my mind, that means we haven't found the right shoe that fits. Keep in mind, we have some clients that would go through all of our programs until we find the right one that fits for them. They may start off in rapid rehousing where or transitional, or even emergency shelter, just trying to get them off the street to see what the basic needs are. How can we help you? What are you bringing to the table? What trauma are you bringing from your past that keeps you wanting to be housed? Is it drug addiction or separation from family or death of a loved one or loss of a job? So we have several clients that come through the system that wear every shoe until they find the right one that fit. But I want to also highlight the individuals that moved into shelter or housing. That 4,548 people is a substantial amount that we were able to get off of the street. And then we had almost 3,000 people, 29, 21, that were new to home housing, which we're seeing a lot of based on people can't afford their houses anymore due to property taxes or rent increases. So that 1627 is what we are currently working with to try to find the shoe that fits. Here are San Antonio's and City of San Antonio's investments. The general fund and solid waste. Solid waste fund is in there as they play a significant role in our encampments, working with the encampment teams to clear up the streets and keep the even if there are encampments, right? We can't dictate where people live, but to at least to make sure that they're clean. How much money we're getting from the HUD grants, the state grants, and the COVID grants, which we're still receiving some of those. So the breakout of our indirect costs, right? The general fund, which is applied over a lot of the agencies that we help to support. We're working closely with STRAC to find out how many people are high utilizers of our medical system and how we can help them with that. And so that is a total cost, direct and indirect cost. That 48 million of what the city of San Antonio is investing in to help alleviate some of the homelessness. Here's our strategic priority plan, what we are trying to do, our recommendation, and then the outside strategic plan recommendations as well. So the collective leadership impact, that was the actual expense. We budgeted $1,391,000, but that was the actual expense of where it was spent. Our housing options, the street outreach, just doing the analysis of what this all looks like for us, right? Is where we spend a lot of time collecting the data and making sure the data is telling the story and connecting the unsheltered to housing. That's a lot, but it's paying off, as you can see by the previous numbers. So that's how much we spend also. If you look at the outside strategic plan recommendations, the encampment and abatement, direct and indirect, we budgeted 2 million, we spent over 3 million, right? The homelessness prevention plan and the diversion plan. And for those of you who don't know what diversion is from our city standpoint, diversion is for us, in working with close to home, we've established diversion for us is to keep people from touching the system. If there are people, we have some families who are working 2 jobs, right? But they were evicted before. They can't pay the high security deposit or the high risk fee for getting into a place. The diversion plan does that. So there is a way for people to come into this system without touching the homeless system. And that's what the diversion plan does. And of course, we see the Homeless Veterans Coordination. That's always going to be a bright spot, being that we're Military City USA, helping to find those reasons why our homeless veterans sometimes choose to stay unhoused. So now we're going to go into our system accomplishments. Yay! We have the Low Barrier Shelter, the Sam Ministry Low Barrier Shelter. Those of you who don't know, that's over located on Santa Rosa. We did a centralized shelter coordination pilot, and that centralized shelter pilot is so that the outreach teams, when they have a client who's ready to go, they can go into this coordinated shelter, coordinate the pilot, and they can go in and see if there are beds available. So it gives an immediate read on bed availability for shelters instead of us getting somebody who's ready to go and then taking them to the shelter location and there's no bed availability, right? So the client ends up going back to the street. This has been pivotal in us being able to get clients off of the street just like that when they're ready to go. We've accomplished our online dashboard, which Ms. Ann is going to give you guys the link if you want to see that. And we've been really focused more on not just encampment and abatements, conducting them, but making sure that we have an outreach presence there for those clients who are ready to go when they have the abatements. Our system accomplishments is we have started doing framework training. Close to Home has implemented a training program so everybody is standardized across the board in their training of shelter care, how do we get people system changes, updated to system changes, what is available out there for everybody to be standardized. So every different agency, local, nonprofit, city, partners are all trained the same to provide the same level of care when they're out there in the streets with our clients. Permanent supportive housing, we talked about that a little bit already with Sam Ministries and the implementation or the groundbreaking of permanent supportive housing. Even Town Twin Village is having another grand opening for another phase of their permanent supportive housing. We have a skilled nursing program now. Close to home, was able to secure some places, some spots over at San Pedro Manor. And San Pedro Manor, through that program, is actively taking clients. I think they're full now, but we have, I think, 9 clients who are there who need more care, who can't meet their ADLs to go into shelter. They're now being assisted with permanent long-term care at the skilled nursing pilot at San Pedro Manor. And then we did a 90 families in 90-day challenge through the COC. And that was to get 90 families out of shelter and get them into housing within 90 days. And that was a successful event for us as well, especially given the amount of housing and availability and affordability, not only getting them housed, but making sure they can sustain and not come back into the system. We also work with community court. Our community court works with the Bexar County DA's office, and they actually go to the court for our unhoused clients who have misdemeanor charges, who could be barriers to housing, even getting ID cards, right? And they work with them and enroll them in programs. So at the end of the program term, the client could have whatever those charges are dropped or expunged, so the client can have a fresh start going through, if it's psychiatric or drug rehab or whatever that looks like, to get the client from the point of going to be incarcerated, which is not the answer, to getting them a fresh start and starting over. That's what our community court does. And we have a representative here who goes to the community court on behalf of our homeless clients. The medical respite care, Corazon is doing that. They're going to start that in 2025. They also have medical teams that's going to be out there with them as well. And so we're partnering with CAM Ministries for the street psychiatric care. And that's going to be to provide psychiatric evaluation and medication management. So we do know that in working with Stracted, a lot of our clients that are going back are clients who do have some mental health challenges, but they go and get treated, and then they don't go back and get medication, which only exacerbates with their condition, right? So since they have a lot of those clients who are already coming to CAM, it just made a lot of sense to be able to get the team and stuff there to be able to monitor the medication and hopefully get them stable enough where we can start looking at considering housing. So our strategic priorities going into 2025 have been to prevent homelessness and reduce overflow, expand housing options, strengthen the homeless response for services for youth and young adults, improve the coordination and access to the domestic violence services, improve access to healthcare, strengthen the street outreach coordination, effectively address equity and accessibility, and strengthen the system and partner capacity. Our strategic priorities are in line with what I just showed you, right? So keep account of the annual report, develop the Community Connections Hotline, which we just did in October of last year. The Homeless Connections Hotline was changed to the Community Connections Hotline. We got some teams from the Family Assistance Division, and we took some of those family support workers and combined them with the hotline to be able to expand the capacity of the Community Connections Hotline to include like case management and not just being inside on the phone, but being out there with the clients when the clients come across to the hotline that need the most help. Increasing the housing options, respond to 1,300 encampments. We try to get enough shelter space to be able to exceed the 500 clients placed through the coordinated shelter system, coordination system. To maximize the opioid treatment programs for the unsheltered clients. We are now looking at, before we just had one treatment facility in one part of town. Now we're looking at expanding to have one in every part of town. So the clients can go to whatever one is closest to their encampment, to their families, to their shelter, whatever that looks like, just be able to provide the options for them to have a choice in where they want to go seek their treatment and keep advising close to home on the strategic plan. And I know that was a lot. Is there anything else before I go into the next part? Do we have any questions?
I had a couple quick questions. And then David has his hand up. Where you just talked about in every part of town, the last thing you were talking
Yes, ma'am.
about. Have you thought about having those spaces like in congregational facilities or something? What are those going to look like?
Well, we have, excuse me, I'm going to be 100% honest, I have not thought about having them in the congregational setting because sometimes that can be a
You can go ahead and say it.
no, 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 I know. Sometimes that can be not where the client wants to go. But it's not something that we won't do, right? I need to make sure I emphasize that. If we can gain enough traction where we think that maybe what clients feeling comfortable, because I think like you, every chance that we have with somebody is an opportunity to minister, to
We're just
let
talking service here, to help people. How do we,
Well, yeah, well, when people go to a congregational setting, that's the expectation, and I guess that's my
Ah,
point. The
ah,
expectation is that I'm not going to go there if somebody's going to be preaching to me.
right. Got it. Got it.
So
David,
that
I'll
was
say my other question. David, your hand's up.
Yes, thank you. Good morning, Kathy. Thank you for all this great information. I think it, gives a great perspective of just the vast amount of work that you guys are doing at COSA to combat the homeless situation. The question that I do have is I noticed that in the financials, it appeared that about 38% or almost 40% of the funding came from the COVID relief funds, which is no longer available. So now it seems as if the budget is closer to about 62% of operational capacity from fiscal year 24. Would you be is programs like this community connection hotline, are they in jeopardy for fiscal year 25 or 26 due to the funds being exhausted from the COVID, or
no,
is the funds also being backfilled?
no. So when we knew the COVID funding was running out to support our local programs, that funding was changed to general funds, so now it's only been funded by the city. When we started like for example, the Homeless Connections Hotline, when it started, we were all grant funded here. And then as COVID started to wean itself out, right, we changed the funding to general funding. And with that funding, I must say, it allowed us to make the changes that we made going from homeless connection to community connection, and then expand what we were able to do, not just for San Antonio, but to reach into Bear County as well. So I don't know much about how the whole funding thing shakes out. I'm going to be 100% honest with you. I don't know how all of that translates to what is and what was, right? I just know that all of the funding that we're losing, we're switching all of that funding over so we don't lose any capacity. And then in the change, where else can we get money from to be able to support it? And that's the extent of what I know. I'm being 100% transparent. I don't want to talk about dollars and cents because my budget here that I run for the homeless division is all I can talk about. I can talk about the contracts going out everywhere to all the local agencies and who's supporting who and how much they're getting. Yeah, I just know what
Yeah.
what in the homeless division.
And I think we might not even need to go into the next part. I mean, might we just flip through them? But another question that I have before we run out of time. Do you still have about 5 minutes, Kathy?
Yes, ma'am. As long as you need.
Okay. The other question that I had that I think is important to folks here too. So San Antonians who work in this effort, right? The outreach folks, the calling in. We do a course, a lot of conversation around compassion, having compassionate systems, self-compassion. How do the folks that are doing this work, how are they take caring themselves? How do you strengthen are there systems or things that you're doing?
Yes, ma'am.
Do you understand what I'm asking? How
Yes,
are you taking care of yourselves?
So we have a standard practice here, right? In the course of our work. Number one, we all went through the trauma-informed care training, not for ourselves, but to help us help each other, right? I think that's important, especially in this work. It is very, very challenging, very taxing. So mandatory breaks in the day, right? It can be overwhelming. We are authorized breaks during the day. If someone is feeling overwhelmed within the course of before their break or after their break, I think I need a minute, right? Or be right back. Or, they can text in Teams and I'll be right back. I need a minute. And then they go take their break. Luckily for us, we have where we are working from, there's a walking trail that may be 5 or 10 minutes around the building. It's a great way to woo-saw it off. Um, we do a lot of activities here, a lot of fun things, right? We celebrate a lot. And it may seem like, oh, that doesn't make any sense, but believe me, when you are being recognized from behind the scenes for things that you do that are taxing to your mental every single day, um, not just being recognized, but the camaraderie that you have with the team and with the agency and the leadership. Leadership plays a big part in allowing us to be a little less overwhelmed by our job here. And it's not just the hotline operators, right? It is also the outreach teams that are out there physically seeing people. It may seem like it's tough for the hotline but they're only talking on the phone, right? That connection on the phone is only as deep as the client lets us be. It's tougher on the outreach team, the people who are actually seeing it. Um, so we do constant check-ins with them, go out in the field. Hey, how you doing? What do you need? How can we help you? It's more of a hands-on approach to being able to recognize your team when they're struggling, when they're having problems, making sure that we are available to keep the systems um, as stress-free for them as possible. And this homeless division team within the city is really, really close, right? So somebody can say, hey, so and so was having a hard time this week. Their mom was sick. Okay, can we move them to someplace else so we can get their mental right before they go out and start tackling on somebody else's problems? The trauma-informed care is something that we reiterate over and over and over and over and over and make sure that we practice. And I even tell Patrick all the time, what they're doing is not trauma-informed, and we need to fix that, right? Because we wear the badge of that because that's how we have to be with each other on the team as well as the people that we're working with out on the street, right? We have to be able to recognize when people are not feeling like themselves. I also have a strict policy, not 1 minute after 4:30. I'm big on work-life balance. I'm really big on work-life balance, right? Not 1 minute. At 4:30, the door needs to be locked and everybody needs to be out. But aside from that, we have a lot of team activities that we do together. We have not just training, but we have exercises that we take a day, like we have one coming up tomorrow, right, on Friday. And in that training mode that we're in, there are going to be a lot of trauma-informed opportunities for people to express what they've been going through. How can we fix it? What does the system look like? How can we help revamp this to make this better? So all of those things really keep the morale up on the team and not not inhibit their passion for wanting to work. Because burnout is easy and it's fast. So we try to just keep that to a bare minimum. And for all of you too, if you have staff that work for you, it's more than about asking the person how are they doing, it's listening to the response that gets you where you need to be, right? When you say, hey, how you doing today? Oh, I'm doing okay. That warrants a conversation. If the response is normally, hey, I'm good. Let's rock and roll. Let's get moving, right? It's those little telltale signs that you recognize in your team. And you should be speaking to your team every day. I go to every department every morning during their meeting and say, hey, how's everybody feeling today? What's going on? And if I recognize it, we need to have a conversation. What's going on, right? So
Well, I want
that's
to thank you for coming today, Kathy. We try to close no later than 8:45. I did
oh
want to bring up this website. This comes out of our collaborative work, Healing SATX, and but it's about how communities suffer trauma too, and how we heal. And even one of our examples earlier from Peter about block parties, there are different ways countless ways that we can heal together. But this is all the science over here on the left. It doesn't sound like it, but it is.
yeah.
So those safe places, listening, naming the pain is critical to how we heal as a group of people, building relationships. So celebrations help do that. Talking about what's going on with the body, outdoors, humor. We need lots of oxygen to think togetherness, what's going on inside us, what's going on outside us, and remembering that being, feeling, and thinking together is what creates community. And also remembering that hate is not the opposite of love. I'm going to leave it here. It's been a great morning. Thank you, Kathy. I think that's exactly the update this group was looking for. And
And if anybody else just wants a homeless presentation, aside from what we had here, we do give homeless presentations throughout the community. So you can know what we are doing, right? What the programs entail. And it's a little bit more explanatory, like the housing programs and housing options. You guys can reach out to me. I will put my email in the chat. And just reach out to me and we'll schedule it. I can bring if you want to hear about encampments, we can have the encampment team come out. If you want to hear about outreach, the outreach team can come out, or just a hotline, right? We do that community-wide, so everybody knows what we are doing to help our unhoused neighbors.
thanks again. It's a
Thank you.
beautiful day out. Everyone have a good one. And we'll see you next week at the intersection. Bye.
Bye.
Thanks, Kathy.
You're welcome.
Bye. Thank you.
Bye. You're welcome.